All right, welcome to this last segment of the show, and today on First Aid we are focusing on wounds and deep cut injuries. What do you need to do before an ambulance arrives in case you have a deep wound or a deep cut injury or just a wound? And to help me with this, we have Florence Odhiambo, a trainer at St. John's Ambulance. Florence, karibu tena.
Thank you so much.
Good to see you.
Good to see you too.
All right, tuanze kazi. So we're talking about a wound and a deep cut injury. How different are they, and what qualifies one as a wound and a deep cut injury from a medical standpoint? I understand you have a background in this, so you'll be best to answer that.
Okay, thank you so much. So now a wound is basically where you have a tear or laceration on your skin and blood is coming out. Then as you said, deep cut is a deep injury where you're having probably severe bleeding or as a result of that cut or laceration that you have. Yes.
What is the best time span, to administer first aid to somebody, say, who is deeply bleeding? That person with a deep cut injury. I hear there's something to do with 5 minutes rule, but what would you say is the exact amount of time to conduct first aid?
So now I'll not give it a specific time frame, but as soon as someone is bleeding, the first thing that you need to do is, one, to apply direct pressure. So if someone has a cut on their hand, you either hold or ask them to hold where they're bleeding and elevate their hand. So that will reduce the amount of blood that will be coming out. So once you've done that, you want to take your dressing or you want to take your bandages that you have with you and you cover or you tie the wound or the injury and rush your casualty to hospital. So we say when someone is bleeding profusely and they're not being treated, they're not prevented or they're not trying to stop that blood from coming out, chances of them going into a shock is very high because their body is losing the blood, the fluid. Then you notice their skin is starting to turn pale, that is white. Their lips could be turning black or bluish color depending on their skin complexion, meaning that their body is losing that fluid. There's no oxygen, there's no blood in the body, so they tend to go into shock. So this person should be taken to hospital as soon as possible. Yes.
So is that the point where medical attention is very severe even before you conduct first aid? Let's say you're talking about pale lips, they become pale in the skin as well. Do you need to take them to the hospital at that particular point or start with first aid? So
you definitely want to start with first aid because if they continue losing that blood, it means their heart might stop functioning, which we call the cardiac arrest, and probably they might go into a coma and later on maybe die. So we need to first, of course, do the first aid, then rush our casualty to hospital, or you can be rushing your casualty to hospital while still administering first aid to them. Yes.
So Florence, what are the first things that we need to know, of course, before attending to, say, these wounds or deep cut injuries? What are the different types of wounds that we have?
Okay, so the wounds will be different determined by what will cause them. So you have laceration or what you call a tear. A good example would be a barbed wire that pierces through your skin and it cuts you. Then you have incision wounds. Those ones are caused by sharp edge, something like a knife or a razor. Then you have a graze or an abrasion where it is the friction injury. A good example, when someone is playing either basketball or any sport, then they fall on the ground and then they just graze their skin. Okay, that one we call it a graze. Then you have gunshot wounds. I think this is very common. You've been seeing it of late.
Yeah.
Yes. So those are some of the examples of the common examples of types of wound. We have the avulsion where the skin is either hanging or falling on the casualty's skin. Yes.
Do people see such?
Yes, these are very common types of injuries, wounds that you normally see. Yes.
So how do you handle each of these? Let's say somebody with, you say skin is hanging, a gunshot wound. A gunshot wound, you said we have to
apply direct pressure.
Direct pressure on it. But how do you handle the one that's incision, the one caused by, through a barbed wire? How do you handle such?
So now with an incision, if it's just a minor cut, a good example is when you're cutting your onions or your tomatoes, then you end up cutting yourself. So the first thing is at least clean the affected place. Then you want to pat it dry. Then you can cover it using a sterile dressing or an elastoplast. If the wound is not as big, then that one can easily be managed at home. But for something like the avulsion where the skin is hanging, they're having a cut and a big part of it is hanging, definitely this place is bleeding. So you want to first stop the bleeding as much as you can. Of course, you need to wear your PPEs, your gloves, very important. Do not go touching anyone's blood with your bare hands. You need to wear your gloves. If you don't have gloves, you can always improvise with polythene papers or a plastic wrapping so that you don't end up touching the other person's blood. Then once that is done, you want to cover the affected place. Yes, you'll try and return the skin as much as you can. I know it's a bit scary for some, but just try and return it. Then take your dressing, you cover, and you take your casualty to hospital for further medical assistance. Yes.
Let's talk about those injuries with, say, glass zimeingia ndani and they're heavily bleeding. Should one attempt to remove those glasses or particles or things that, you know, are on top of the wound?
Okay, so for that, we call them embedded objects on a wound. So for instance, someone has been stabbed by a knife or even the glass shrapnels that you're talking about, they're stuck and they're still embedded on the skin. Please do not try and remove it. Why? The moment you remove it, it means that this place will start bleeding, number one. Two, you might end up hurting or cutting more nerves as you're trying to remove the object. So what you need to do, we say make a cushion or make what you call a donut.
You can use my hand.
I can use your hand, sure, thank you. So now just allow me to first make the donuts, then I'll show you what you're going to do. So this, I'll just take my bandage or any dressing that I have with me. Could be a shuka, a lasso, a tie. Then you just want to make something that looks like a donut. It's normally round. So with this, you just go in and out all the way.
That is if the knife is stuck?
If the knife is still stuck there, if a stick is still stuck there, if you still have glasses or a glass on your skin, so you're saying do not try and remove that.
So in the event of a large cut or a deep wound, is covering it really, really necessary?
Yes, we need to cover that so that, remember, we're trying to minimize risk of cross-infection or even the injury getting an infection. So if you're assuming this is a glass or this is a knife that has been dodged in your skin and it's still stuck there, you'll make your donut, then just try and place it on top of that so that it covers at least all the way up. Then once you've done that, you'll take your other dressing and then you cover it loosely on the other end. So just allow me to do that shortly.
All right.
Of course, remember you're wearing your gloves at all times. So you'll take this and just cover it on the edge, side to side.
Isn't it painful to the patient?
Definitely it's painful, so you need to talk to your casualty, you reassure them that everything is going to be okay. Okay, let me just roll this back. So in your tying, you want to avoid unrolling the whole bandage because now it becomes a bit tedious for you to tie it. So definitely you're reassuring your casualty that help is coming and you'll be taking them to hospital soon. Okay? So once that is done, you want to support it at this angle as you take your casualty to hospital. Yes.
So they have to hold their hands like this?
So they can either hold their hands or we can tie what we call an elevation sling. So you'll take another bandage. Then from this angle, you just want to support it.
Okay. Today I'm your casualty.
Today you're my casualty.
Okay.
Okay. You want to tie an elevation sling. You just tie it loosely like that. Then fasten the edge And then you can take your casualty to hospital in this state. So now you're also avoiding the unnecessary drama that people would want to come and see what is happening, as well as protecting the casualty's hand, because I know it might be very tedious for you to hold your hand like this all the time. So this, with the elevation sling, it helps you and makes the work easier for you as you're going to hospital. Then it also restricts unnecessary movements. Yes.
So you're talking about sometimes if I want to remove that knife, it might cause a lot of damage to the already available scar.
Yes, yes. Do you want me to remove it or you?
Now, you know, my concern is if this were a knife, for example, already it's on my chest and I feel a lot of pressure there. So doesn't it serve the same purpose? You could cause more pain and pressure.
So now, remember, we need to take you to hospital for urgent removal of that knife or that embedded object on your skin. So this just minimizes you hurting yourself even further. Or if we tie it completely, then it means you're even pushing that knife deeper inside and causing even more pain to you. So this is the first step as we take you to hospital. Definitely you're going to the emergency room and then the doctors will attend to you, yes, as an emergency case.
All right, so how do you safely, okay, you can remove it. How do you safely clean a wound without making it worse?
How do you safely
clean a wound without making it worse? Say, can we still use this example, the knife one, or what other wound do we need to clean?
So now, definitely with the embedded object, that is the knife, the sword, the stick. We had a case of a child with a fork jump on the head. That one we are not even cleaning because we need to take you to hospital for urgent removal. But then you're looking at small cuts, the one I've mentioned, you're cutting your vegetables and you cut yourself, or a razor has cut you, a scalpel has cut you. That one you easily clean it with either soap and with water, or if you're having your disinfectant, that is the spirit, or you're having your antiseptic, water and Dettol, you can easily clean that. Even for sports injuries where you see people are playing and then they have these grazes or the small lacerations, okay, you can clean with your water or your surgical spirit or with your antiseptic water. That is, you mix your Dettol, if you're using Dettol, and then water, then clean the wound. Then you need to cover, then take them to hospital. So for covering, we'll use the sterile dressing that we used the other time. The same one.
The white one.
Yes.
All right. What should be there in a first aid kit for wounds?
So now for wounds, definitely you need your gloves, okay? You need your sterile dressings, and they'll come in different shapes and sizes again. So this is a medium one, there's a large one for larger wounds, okay? We have the elastoplast or the plasters that you can also use. Then you also have your dressing, your bandages, now the triangular bandage that you need for specifically just for wounds and bleeding. Yes, then you can have your kidney dish where you're going to mix your solution or your water as you're cleaning, and then a cotton swab just for lightly cleaning on top. Now with the cotton wool, remember if you dab it directly there, chances are there are those small pieces of wool that will get stuck on the wound, and then as usual people would be tempted to now start pulling it out, and when you're pulling it out you might end up hurting yourself even more. Yes.
We hear a lot about some home remedies, ash, sugar, wengine wanasema unga ya ugali. How essential are they? Do they work or do they cause more harm?
So now, remember you're introducing a different agent to your clean wound or to your open wound. So if this can cause either an irritation or further injury, you see you're hurting yourself even more as opposed to protecting yourself. So I think the best would be, if you don't have any of that, then salt would be good for just cleaning the affected wound. Then you want to monitor and observe it. Is it getting worse? Is it healing? Do I need more medical attention? Then you can judge from that. Yes.
Say bleeding stops. Does that mean that the casualty is now out of danger if the bleeding stops?
So now, out of danger in the sense of they're not losing blood, then that's okay. But they still need to seek medical advice. Now, as you're treating the bleeding, probably you've tied one of the bandage and then you notice the blood is still seeping out. So what do? Please add another one on top and tie it maybe just a bit tightly so that you help in applying direct pressure, and then you rush your casualty to hospital. Yes.
How tight should that tie be, and how loose
Should that tie be? Good. So now how do you check? If someone has a cut on the hand, you want to use what you call the capillary refill. So if the casualty, for my case, I have a nail polish, so I'll check my capillary refill on this part. So you want to press on the other part. When you see it turning white, then when you release it, you notice blood is coming back very fast. Then it means it is not too tight. But if you're pressing and releasing and blood is taking time to recoil back, then it means that that place that you've tied, either it's too tight. Then two, when you ask the casualty to try and move their either fingers, they'll tell you they cannot feel that. There's probably numbness that is happening. Then it means you've tied the bandage too tight. Yes.
I've heard of something that sometimes wounds need to be left uncovered and open. Encourages, a faster healing.
Fast healing.
How is that true?
Well, it is true, but that one will be done after you've been given some medication and some creams to apply on the wound. So now whatever you're looking at is the first aid, that the immediate help you're giving this casualty. So once we've done our first aid, they've gone to hospital, they've been given particular medication or creams, then they can be using that and letting, if the doctor will allow them to let the wound dry, then that's okay. Yes.
How important is a tetanus shot? Is it a must to get it? Say after a cut, you're a barbed wire, or just say a knife? How important is it to get?
It is very important. We actually recommend that after someone has been cut, or when you have a casualty who's been cut by anything metallic, you ask them to go get the tetanus shot, because you never know if the metal had anything. You're just trying to prevent them from getting any infections, in other words. So it is very important that someone goes for a tetanus jab for any injuries caused by metallic objects. Yes.
Say I am alone in the house, I am injured. What's the first thing that I need to do? I don't have anyone else, to tie these things and just, hata hiyo ya kisu ikikwama hapo kwa skin. What is the first thing that I need to do if I'm alone?
What's our first reaction? I know mtu akikatwa ama mtu akiumia, we always shout, "Tui."
Okay.
That's the first thing that I tend to see most people do. So you can always call for help, call someone to come and assist you. If you're alone in the house and you're able to get to your phone, please go get your phone, dial an ambulance, dial a relative number or your neighbor, then ask them to come and assist you. Again, if you don't know how to go about it, you can always call, for instance, the St. John ambulance number, and the dispatcher on the other end can guide you on what to do. So you tell them you're alone, you've had this injury and you don't know what to do. They'll be a very good help, and they'll help you on the steps to do before you go to hospital, and the first aid that you need to do to yourself before you go to hospital.
So when is, say, redness, swelling, or pus, a cause for alarm?
So with a pus, then it means that that infection has been contaminated, or it's getting worse, what we call the sepsis infection the other time. If it gets to that point, then it means that either you're not taking your medication, or you didn't go to hospital and the doctor did not give you some particular medication, for instance, the antibiotics. So it means once you notice pus is still coming from your wound, you need to go back to hospital and seek further medical attention. Yes.
So can it lead to, say, serious complications if that first aid wasn't done properly?
Absolutely, yes, it can. And I'll relate that to cases of burns, where we see people use the traditional methods. Then when you try and touch where the person had the burn, you notice pus is coming out. So with that affected part, one, they're not even able to move that limb completely, or they're having difficulty in moving that limb. So it can even lead to issues where this person is not even able to move that limb completely. Yes.
So what signs could indicate that, say, a wound has been infected? I know we've talked about the pus, but aside from the pus, what else can indicate?
So now the wound where the injury is, you notice it's turning a different color. So there's the blackness, or there's the grayness, meaning that it has an infection. Then there's the swelling, of course, and then of course now the pus that you're talking about. When you press it, you notice pus is coming out. Yes.
What are some of the mistakes that you see people make when tending to wounds and deep cut injuries?
So one, I think, would be lowering of the limb. So if it's the leg, you let the leg stay down instead of elevating it. When you elevate it, you're reducing the blood flow from coming out. Then also with the hand, you see people tending to suck their blood. That's wanarudisha damu kwa mwili. It does not go back to the body. It does not happen like that. So you need to treat that as urgent as possible. So for any bleeding, you're saying applying direct pressure and elevating. That's the best thing that you can do. Then rush your casualty to hospital. If it's a severe bleeding or severe injury, yes.
You know, when you're talking about that knife, that we should not remove it from the skin. Sometimes somebody is cut and the hand is hanging. Should we attempt to return that hand, or how do we handle that when now the hand is almost falling off?
Yeah, so now that goes to amputation, where we have either complete or partial amputation. So with the partial amputation, the hand is still hanging down. Please try and support it and cover as much as possible. And either now we want to do a different sling, what we call an elevation sling, and rush your casualty to hospital. If at all it was a complete amputation where the hand is now completely chopped and it's fallen on the ground, what you want to do, again, for any bleeding, we say we are covering to apply direct pressure, and you're elevating the limb. Then the hand that is on the ground, or the finger that is on the ground, you want to take it, put it in your clothes, then dampen the cloth a bit, okay? The finger is inside or the hand is already inside. Then you want to place it in a polythene paper. If possible, if you have ice cubes, the better for you. Place it in an ice cube. Then you want to label the name of the casualty, the hand, is it a right hand or a left hand, or a right finger or a left finger, okay? Then the time of the injury. This way the doctors are able to know if they're able to revive the nerves back, and they're able to restitch it back to the injury.
All right.
Yes.
Interesting. Thank you so much, Brenda, for making time for us to have this conversation on first aid. You're talking about wounds and deep cut injuries. Asante sana.
Thank you. Appreciate
All right. That is Florence Odhiambo. I did call you Brenda. You know, we usually have Brenda as well. That is, I'm sorry. That is Florence Odhiambo, trainer at St. John's Ambulance. And that brings us to the end of this show. Good morning. My name is Anne Odida.